Epithelioid peritoneal mesothelioma is diagnosed through a combination of medical imaging tests, biopsy, and pathological examination. Often, the first sign that something may be wrong is non-specific abdominal symptoms such as abdominal pain, swelling, weight loss, or a feeling of fullness. A doctor will likely perform a physical examination and ask about risk factors like asbestos exposure. They may then order some initial tests. Medical imaging plays an important role in the diagnostic process for epithelioid peritoneal mesothelioma. Computed tomography, CT, scans of the chest, abdomen, and pelvis provide detailed images that can detect abnormal thickening and masses on the peritoneum as well as enlarged lymph nodes. Locations deep in the abdomen may be more difficult to see than superficial lesions. However, positron emission tomography, PET, scans, which show hypermetabolic or rapidly growing tissue, can help differentiate between benign and malignant masses that were detected on CT. PET/CT fusion scans combine the anatomic details of CT with the functional data from PET in a single test, aiding in detection and characterization of lesions. Magnetic resonance imaging, MRI, may also be useful in identifying peritoneal involvement and assessing organ invasion. Ultrasound exams of the abdomen are usually not very sensitive for detecting peritoneal tumors but can help identify ascites, which is fluid accumulation in the abdominal cavity caused by blockage of lymphatic drainage. Analysis of ascitic fluid through cytology, in which cells are examined microscopically for abnormalities, may provide evidence suggestive of malignant mesothelioma, but cytology alone does not permit a definitive diagnosis. Analysis of tumor markers in ascites such as hyaluronic acid can aid in the diagnosis of peritoneal mesothelioma versus other abdominal tumors. Scoring systems have been developed to estimate the probability of peritoneal carcinoma based on clinical and cytological criteria. Given limitations of non-invasive imaging and ascites analysis alone, tissue biopsy is usually required for a definitive pathological diagnosis of epithelioid peritoneal mesothelioma. Image-guided core needle or surgical biopsy allows acquisition of tumor cells and tissue for staining and microscopic examination by pathologists. Under the microscope, epithelioid mesothelioma cells resemble epithelial cells and form tubulopapillary or glandular structures. Immunohistochemistry staining shows absence of markers like thyroid transcription factor 1 and cytokeratins 7 and 20 that would suggest an alternative primary site. Staining positive for markers such as calretinin, cytokeratin 5-6, D240 and Wilms tumor 1 support a diagnosis of mesothelioma. Electron microscopy may also detect characteristic mesothelial cell junctions and intermediate filaments. A thorough pathological report is able to differentiate epithelioid peritoneal mesothelioma from other peritoneal surface tumors based on immunohistochemistry, histology and clinical presentation. Mimics that must be excluded include peritoneal serous carcinoma, peritoneal lymphoma, and metastatic adenocarcinomas from the gastrointestinal tract or ovaries. Molecular testing such as fluorescence in situ hybridization, FASH, assays may detect genetic abnormalities that further support a diagnosis of mesothelioma rather than an alternative diagnosis. Detection of the BAP1 gene mutation by molecular testing has diagnostic and prognostic significance in epithelioid mesothelioma. Once the pathological diagnosis of epithelioid peritoneal mesothelioma is established, clinical assessment continues with thorough history and physical exam, laboratory tests and imaging of the chest to evaluate for signs of spread beyond the abdomen. Prognostic classification systems use additional information like tumor grade, stage and presence of malignant ascites to stratify patients into risk groups. Comprehensive evaluation and multidisciplinary care help determine the best treatment approach, which may involve a combination of surgery, heated intraperitoneal chemotherapy, HIPEC, and systemic therapies. Close monitoring after initial treatment is also important due to the risk of recurrence and progression. A combination of advanced medical imaging techniques, needle biopsy or surgery, ascitic fluid analysis, thorough pathological examination with immunohistochemistry and molecular studies is needed for a definitive diagnosis of epithelioid peritoneal mesothelioma. Accurate diagnosis is crucial for prognosis and selection of optimal treatment options in this disease. With a multidisciplinary, systematic diagnostic approach, clinicians are better able to characterize each patient's tumor and develop an individualized care plan.